Looking closely at the effects of a controversial product, University of Otago senior lecturer Dr. John Ashton is researching the possible health effects of cannabidiol, an active compound found in cannabis. It's different to THC, which causes a high in patients, something that's of particular interest as the conversation about the legalisation of medicinal cannabis heats up.
It doesn't cause that high, and it's not really a pain reliever, but it's thought it might help with some types of epilepsy. So all these things seem to get mixed up. So that my first thought is, if there's a push to legalise medicinal cannabis, exactly what are people talking about?
At this stage, there's still a lot that's unknown about cannabidiols in treating specific types of epilepsy. What Ashton is trying to do is narrow down the biochemistry of what the products actually do in the body. He says currently the cannabidiol treatments available overseas often haven't been widely tested, and that's concerning.
In America, they're treated these cannabidiol products aren't even regulated as pharmaceuticals, they're treated as dietary supplements. So the quality control is very poor. Some of them contain, some about 2/3 of them contain a different amount of THC than they claim. Some of them much more, some of them less.
Ashton says medicinal cannabis is a difficult research area, but one that a lot of academics around the world are focusing on. While he says the conversation about its use in New Zealand doesn't directly impact his research, it's a field in which information is lacking.
There's a demand for high quality clinical research, so a lot of the evidence that comes for epilepsy and cannabidiol comes from parent anecdote, and that's fairly low quality evidence. There's a great deal of risk of bias in seeing what you want to see.
Ashton's attempting to understand the science behind what goes on during clinical research trials to refer data back to those conducting them. It's a lengthy process, but one that could result in increased treatment options that are backed up by science. Ruby McAndrew, 39, Dunedin News.